Hello.
Hi.
Hi.
Are you Hadley? Hi, Hadley. My name is Fred, and I'm going to do an assessment. We're going to talk about what's been going on. What's your name?
Olive.
Hi, Olive. How are you?
Good.
Good. And what's your name, Mom?
I'm Brett.
Hi, Brett.
Hi.
Good to meet you.
Nice to meet you.
All right, so we washed my hands before I came in. It's a very important thing. And Hadley, how old are you?
8.
Great. And I'll be asking Hadley some orientation questions to make sure she knows where she's at. And if she was in some kind of exacerbation, she'd potentially have some hypoxia. So there could be some there could be some issues answering some of these questions. What year is it, Hadley?
2018.
And where are you?
It's Saturday.
The day is Saturday, but where are you right now? Are you at the doctor's?
Yeah.
Okay, very good. And so what is the month?
June.
Yes. The last day of June, isn't it? Very good. So we did have these vital signs, and for an 8-year-old, they are all within normal limits. So she has a respiratory rate of 16. Her blood pressure is 100/75. The pulse is 96, and that is all within normal limits. Her height is 4'3", so that puts her at 51 inches. And her weight is, how much is it? 70?
69.8.
69.8. So that puts her at a healthy BMI for her age, for her height. And asthma is strong, or I'm sorry, obesity is strongly linked to asthma. So if she was in an exacerbation, you might see her have a tachycardic. She could be hypoxic. She could have some anxiety because she would have some shortness of breath. And I'm observing for behaviors, so I like her to see if there's any eye contact, but she has great eye contact. She's cooperative. Make sure her speech is clear, unlike mine right now. And she's well groomed, so you want to make sure everything looks okay. And do you have any known allergies? Does she have any allergies, Mom?
We have seasonal allergies that
Okay.
I give her a daily Claritin for.
All right, and does that help?
Yes.
Okay. And any food allergies?
Not that I know.
Anything to medications?
Nope.
Okay. How's your sleep been?
Good, but sometimes I wake up and I have a hard time breathing. I have this weird cough that's really chunky.
Junky cough?
Yeah, and it usually happens in the morning or the
Middle of the night and morning. Wow. Okay. And have you had to miss any school because you've been sick?
Well, I've had a cold, and after that cold, I usually get the chunky cough that I have now.
Okay. So you have a cough right now.
Yeah, but it didn't happen as a cold, so
Okay.
it's a chunky cough.
All right. And then I'm assessing her level of consciousness, which it's she's alert and oriented. She doesn't look like she has any shortness of breath at this time. And okay, Hadley, so we're going to check out your head, your ears, eyes, nose, and teeth, okay? We'll do all of that stuff. So I'm going to use a little light. We'll be shining a little light. I'll have you look up, and I'll be looking into your ears and things like that, okay? And asking you some questions. How does that sound? Okay. So what I want you, go ahead, Mom.
Oh, I was just gonna say that this is the reason that we're here, though, is because every time she gets a cold, it turns into a cough, and then it turns into this long wheezing, probably for like a month afterwards.
Okay.
So.
All right. Okay, Hadley, can I have you look up at the ceiling? Good. And I'm just going to be shining this light. First, I'm going to go into your eye. We're going to go into the left side. Just check the pupillary reaction. Very good. Other side. Very good. I'm going to go ahead and look up, all the way up. I'm looking down your nose, and I'm inspecting here her nasal turbinates. Make sure there's no inflammation. I'm looking for any kind of occlusion. Hadley, can you blow out of your nose? Oh, you sound a little stuffy. You stuffy? Blow the other one. All right. And then on her nose, you look for a nasal crease, and she has a little bit of a nasal crease, so that's from rubbing her nose when it's been running, and it's also, there's definitely some runniness going on with her nose. And then, let's see here. Can you open your mouth for me? Real long. Good job. So, again, I'm looking back in here, looking at her airway. From the gastrointestinal perspective, I'm looking for any signs of acid reflux or GERD, and that could it's kind of a rule out if it wasn't asthma. It could have the same kind of symptoms. And let me see here, going up your mouth. I'm also inspecting the teeth and looking at kind of the oral hygiene. I'm looking for any inflammation in the back of the airway, any redness. And stick out your tongue for me. Very good. And everything looks pretty good. It's a little bit red back there, but everything looks pretty good. All right, I'm going to look into your ears, okay? So I'm going to sit down and we'll check out your ears. And while I look in the ears, I'm also looking for any inflammation. I'm looking for redness. Has she had any ear infections?
Yes.
She has this year?
Yeah, she had one.
And did she have ear infections?
She gets about one per year.
Since she's been real young?
Mm-hmm.
Okay. That's pretty good now. But those are also kind of risk factors for airway disease. Okay, so what else? We're going to look at some. We looked at the nasal terminates and to see if there's any fogginess, and that indicates that she's had some stuffy nose and some runny noses. And do you have a runny nose? Do you feel like you have a runny nose very often?
Only sometimes. Usually sometimes.
Okay. So I'm gonna feel your lymph nodes. So that's good. I'm gonna kind of touch your neck a little bit and feel for any kind of inflammation there. Okay. So let's go ahead and very good. Check out the neck symmetry. And then I'll also look at the trachea and make sure that that is midline. Make sure that it's not moved over or anything. Looks good. Very good. And from here, I'm going to listen to your heart, okay? And for a heart in a patient with potential obstructive airway, they can have an exaggerated decrease in systolic pressure on inspiration. So when she breathes in, there could be a potential for an exaggerated systolic pressure, and that's called pulsus paradoxus. So let's go ahead and listen to you. I'm going to listen to your heart. It's going to be in 5 areas. 4 of them are your valves. So we'll start off with the aortic. You can just breathe. You don't have to take big breaths if you don't want. And then the pulmonary. Tricuspid. And mitral. And if Hadley was in an exacerbation, we talked about it earlier, she could be tachycardic. And she could also be a little tachycardic if she was taking an albuterol nebulizer or another medication like that. And then I'm just listening to her here. It's great. Okay, and so we'll move on to the respiratory. And I'll be listening to your lungs in a minute, but in the meantime, I'm observing Hadley's breathing. I'm looking at her rhythm. I'm looking at her depth. I'm looking if she's in any kind of shortness of breath, and she seems to be looking just fine right now. Hadley, can you take a big depth breath for me? So another thing I would look at is in her rhythm for IDE ratio, so inspiratory to expiratory ratio. It's usually 1 to 3 for kids. When they are in some kind of an exacerbation, then that's good. The expiration is going to increase because they're unable to get all their air out, and you could see some barrel chesting, indicating some gas trapping, and I do not observe any of that. Okay, so from here we're going to do some percussion. So what that means is I'm going to just bump on you a little bit, and I'm going to listen to see how it sounds, okay? So let's start out with the front. And you have three different, you're looking for three different sounds. You have the dull sound, a flat sound, and you have a resonant or a hyper-resonant sound. So you're really looking for just a resonant sound. That's a normal lung. A hyper-resonant might indicate pneumonia or gas trapping in obstructive airway disease. And a dull would indicate a consolidation, could be a pneumonia. And then if it's flat, it could be fluid, like a pleural effusion. So let's go ahead and start out. And so I'm going to put my fingers together. So you're looking at the different points. And as I'm doing this, I'm observing her skin. I am using all my senses to look at different things. I'm observing her behaviors, her eye contact, all of that stuff. So we'll go in the back as well. You can only get to the lower lungs from the back side. So, Hadley, do you feel like you start having that little shortness of breath or that cough feeling when you're around cold air?
No.
How about hot air? No? Any kind of pollen or anything? Like during springtime, you get like the flowers blooming and you got the stuff kind of flying around. Do you feel like you're having a hard time breathing or you're coughing or any of that? Runny nose? Okay. Maybe because of the allergy medicine that you give are very good. And is there any history of allergies in the family? Mm-hmm. Okay. And what about history of asthma?
Not that I know of.
From the parents? Is there a history of allergies with parents?
Yes.
Okay. So that's also a pretty big risk factor for obstructive airway disease. And so you talked about your cough. You said you cough in the morning. And you cough. Is there any other times that you have started having one of those, the same kind of cough, and feeling like you can't breathe very well?
Usually when I exercise and play sports and things that are active and stuff like that.
Oh, so it's when you exercise sometimes. Do you sometimes avoid exercising because it's hard to breathe? Mm-hmm. Okay. Anything else about the exercise? And so I'm also observing to see if Hadley is using any kind of accessory muscles, like her nostrils. So nasal flaring is an accessory muscle. She could be using her abdomen and breathing with her abdomen. That's another accessory muscle. And any kind of, like we said before, anxiety. So we'll move on to listening to you breathe. So we'll do a really thorough auscultation of her lungs. So we'll start off on the top. We'll go to the middle sections, and then we'll also do the posterior. Okay, from here, now you open your mouth and you breathe in and out of your mouth. Take a nice big breath. Very good. Definitely has some end expiratory wheezes, and end expiratory wheezes indicates an obstructive element. If you have wheezing on inspiration, usually that's an upper airway issue. Good. Listen to the areas on the back. So we'll go to 6 different areas. We're comparing one side of the lung to the other and the different lobes. You're doing a great job, Hadley. How are you doing, Olive?
Good.
Good. You look like you're bored. Good job. A little bit more and we'll be done. Very good, Hadley. Thank you. So you definitely have a little bit of wheezing. And like I said, it happens right at the end when you're exhaling. So from here, let's move on to your, let's talk about your tummy a little bit, your gastrointestinal. So do you have any abdominal pain, any nausea, anything like that going on right now? Nausea is like you feel like your tummy hurts.
When I'm hungry, when I need to go to the bathroom, and when I need to puke, and
You need to puke, huh? Well, okay. What about when you go potty, when you do go poop? How many times a day do you go poop?
probably once.
Good. Does she ever have times where she doesn't go poop for a long time, for a while?
No.
Well, that's good. Any kind of diarrhea? Very good. We're talking about potty already. Let's move on to pee. Do you have any kind of urgency or frequency with pee? So do you feel like you need to pee a lot?
No.
And then, okay, good. And then you're potty trained. Just kidding. I know you're potty trained. Very good. Musculoskeletal, I'm looking for any signs of weakness, fatigue. Do you feel tired when you're breathing really hard? When you're trying to exercise, do you start feeling like you're not able to exercise because of the breathing?
Yeah.
Okay. And then from here, let's move on to the skin. So I'm going to inspect your skin a little bit closer. Do you have any rashes right now?
Not that I know
Do you get rashes?
of. Yes.
Mom, does she get rashes where it's red and she kind of has raised bumps?
Yeah.
Okay. Has anybody said that that's eczema?
Fun.
Eczema?
Yeah, a little bit. It sounds familiar.
Okay, so eczema or atopic sort of dermatitis is also a risk factor for reversible obstructive airway disease or asthma. And then while I'm down here, I'm going to look at her nail beds and make sure there's no cyanosis. And I'm also looking at her fingers. So if she had club fingers, if they were kind of bent, that would indicate chronic hypoxia. And if they're cyanosis, if it's blue under the nail beds, that would indicate acute cyanosis. Same thing with her lips. Those are the kind of the first areas that show signs of hypoxia. Take a look back here. Very good. You do have a little rash up here. So is it itchy up here? Does your skin get dry?
Yeah.
Okay. So those are all signs of some kind of atopy or allergic. So I think from here, we're probably going to have you go to the respiratory therapist and get it's called a pulmonary function test or spirometry. So what that means is they're all big words for blowing as hard as you can and as fast as you can, and they're going to take some measurements. And they're going to probably cause you to have a little bit of shortness of breath, you know, that cough that you're talking about and wheezing. And then they're going to give you medicine to reverse it. And they want to see how fast it can be reversed. And that shows the degree of severity. So once we just see how much medicine it takes to reverse it or how hard it is for you to breathe, then we can decide how to treat that with medications and stuff, okay? And it's really important that we get you to exercise. You don't want to avoid exercise. You're doing okay now. You get my age, you don't exercise, and you're gonna be a big guy. You know what I mean?
Guy.
Yes, guy.
A guy. I'm a girl.
Yes, I mean a big girl. All right. And from here, let's talk about home. So, has there been any stressors or anything recently? Moving?
Yeah, we moved.
How often have you moved in the past couple of years?
A lot lately.
Okay. So, stresses like that sometimes can be a risk factor for this kind of obstructive airway disease, asthma. Any kind of stress, any kind of, how's your family? Are you married?
We're going through a separation.
Oh, yes. Is that hard for you, Hadley? Yeah. So all that, all of that, same kind of thing. How about your home environment? Where do you guys live? You guys live in a house,
We live
apartment?
in a house.
Okay. Do you have pets?
Yes.
2 cats. Do you feel like you have a hard time breathing around the cats?
Sometimes we do.
She does?
Oh,
All right.
I only sneeze when I first get home, but I have to get used to it.
Okay.
So I'm interested to hear what's your goal?
I want to be able to play sports without stopping, and so I can just keep playing without stopping and taking my inhaler. And I want to not wheeze in people's faces because they question me a lot.
They question
I
you?
don't really like that.
No. Gosh, no. Well, we can fix that. I want to, so typically medication that they start with is a corticosteroid, so it's an inhaled steroid. I just want to ease your mind. There's been plenty of studies, and it doesn't stunt their growth. There have been long-term studies, and there was no evidence of that. So, and it really does a great job in controlling those symptoms, or at least keeping them at bay. And is there any medications that you're taking now?
Allergy pill.
Allergy pill. Is that it? Is that it, Mom?
Yes.
It's the only medication?
She actually does take an inhaler.
Oh, she does. Did you
I
bring the
saw-
inhaler with you?
I think I have it here.
Okay.
Yes.
All
This
right.
one.
All right. Looks like you have albuterol. How do you take this, Hadley?
I open the lid, I put this thing on my mouth, and then when I breathe, when I inhale,
Mm-hmm.
then I push the thing,
Mm-hmm.
and it goes into my.
Okay. Does it help you breathe afterwards?
When I use it, I can't just use it once, but
You have to use it a few times.
yeah, but
Okay.
sometimes it doesn't really work.
Have you seen anything attached to this, like a chamber-looking thing? Okay. So we'll start talking about this education because she will be taking some inhalers and you'll be taking breathing with this. So it's not very effective if you take it just from here. You really have to time it really well, and a lot of times most of the medicine just gets squirted into your mouth, and it gives you those other side effects, like you get your heart rate goes up, and you might feel a little bit like you drank some, well, I guess you don't drink coffee, but you had some sugar or something, or you're feeling kind of hyper. So from what I'm going to give you right now is called an aero chamber, and that attaches to this. So what this does is you puff this in, just like that. The medicine goes in here. It stays in here, so you can really take your time. You don't have to time anything. You know how you have to push that and inhale at the same time, and it has to be perfect timing for you to do it. Well, you don't have to do that with this. The medicine's still in there. Okay. So why don't you?
I have a question.
Yes, go ahead.
Do I have to press it a lot?
No, you just have to press it once, and then what you'll do is you'll take a nice deep breath. You'll hold it in. You try to hold it in for 10 or 15 seconds, and then you'll let it out, and then you'll try to cough some of that stuff up. What you're doing there, let's hear it. Good. So what you're doing there is you're getting that mucus out, and then you're going to take another puff. And what that does, it gets the medicine really deep into there, and it's really going to help you. This albuterol, it relaxes your lungs. Do you guys know what asthma is and kind of how it works?
Not really. I just maybe inflamed lungs.
Yeah. All of it. Looks like you were shaking your head. You know a little bit about it? Okay. What is it?
Sometimes you get asthma on each day.
On each days. Oh my gosh. Okay. So what asthma is, it's kind of, so you have triggers. And it sounds like one of your triggers is exercise. So when you're moving around and you're starting to exercise, you start to have that cough. And you start to feel like you can't breathe very well, so that you can't really participate like you want to. That's a trigger. So another trigger, it sounds like, is maybe during the seasons when they change. So spring, fall, you have to take a medication, and when you have a cold. So all those things are triggers. Mom talked about the pets, so that's a trigger too. If you go into your home environment and you identify anything else that is a trigger that makes her have shorter breath, you really want to try to avoid them. And this will be part of an action plan that a respiratory therapist will go over with you or a nurse. Okay? So this is sort of the beginning of your education. And you know what? And we can have strategies where you can exercise. So if you know you're going to exercise, you know you're going to play, you take a little medicine before. Or we're going to start you on a different kind of medication once we determine it with spirometry, what your severity level is. And you'll take a little steroid, you'll puff a little puff in the morning, and you'll be able to participate in all those things. Okay? And we'll reach your goals.
Great.
Well, do you guys have any other questions?
No. That sounds good.
Very good. So we're going to make an appointment we're going to get an appointment set for you to go to the home clinic, and you'll talk to a respiratory therapist that'll come up with an action plan. They'll come check out your house, talk about your environment, and go from there. How does that sound?
Sounds good.
Good. You want a lollipop? You look like you need a lollipop.
Can I have a lollipop?
You want a lollipop too? Well, it's good to meet you guys.
Thank you.
Thank you.